I'm just going to talk to you about electrolysis. I use the Apilus brand of electrolysis in my clinic. It's a Canadian brand and it's a very well-known brand. In my opinion, it's the best brand for electrolysis in the world. So this is here the Apilus logo, but in particular I'm using the latest model known as the xCell Pur, which is much more powerful than the older models. Electrolysis is a method of permanent hair removal, and it is different from laser. Laser is a system for permanent hair reduction, and laser is only suitable for dark hairs, whereas electrolysis will work on both blonde hairs, grey hairs, red hairs. It'll also work on very fine dark ones that are not suitable for laser. So for example, if you've had laser on your upper lip, a course of treatments to remove or to reduce your dark upper lip growth, your residual hair that will be left after your course of laser treatment is usually very fine, thin hairs that might even be dark in colour, but they're too thin to respond to laser. So we would tidy that up with a bit of electrolysis. So electrolysis is over 100 years old. It's proven over time that it actually permanently removes hair. The more consistent a client is coming in, having the treatment done, the quicker the results will be. So how does it work? A probe is inserted into the hair follicle, and the probe releases an electrical current, and that electrical current will cut off the blood supply to the root of the hair. If the hair is in the active anagen stage of growth, that hair is permanently gone forever. If it's not in the active stage of growth, well then it will grow back. It probably will be weaker, but you will need repeat treatments. That's why you need repeat treatments of electrolysis. When you first come in for a course of electrolysis, be it on your upper lip or your chin area or both, you will have to be consistent for the first 6 weeks. You need to come in weekly for the first 6 weeks, and thereafter then it might be every fortnight or every 3 weeks or every 4 weeks, depending on your own rate of growth. If you are consistent with the intervals between your electrolysis sessions, you will get permanent results, usually within about a year and a half. But if you're haphazard and coming in willy-nilly here and there, you'll be forevermore trying to get on top of your electrolysis. And of course there's a big difference between the Apilus systems and the Sterix machines. The Sterix electrolysis machines are 10 times cheaper than these here, so therefore they're a heck of a lot less powerful. Sterix electrolysis machines work on only 13 Hertz. These ones here work on 27 Hertz. So there's a vast difference in terms of power, so therefore results are going to be more radical and faster with this particular machine. There are 3 stages of hair growth. There's anagen, active stage. That's the stage that the hairs are permanently gone forever. When a hair is brand new, just freshly growing up out of the skin, that's usually hair in the active stage, and that's when we permanently can kill it off. And that's why you should keep your intervals between treatments tight, because you'll have a greater instance of getting more hairs in the active anagen stage. The secondary stage of growth is known as the Telogen Stage. It's the transition stage of growth where the hair is moving up from the follicle, preparing to shed and preparing to fall out. And that stage of growth, when you treat that hair with electrolysis, it will grow back again. It won't be as strong, but it will definitely grow back again, and it's not permanent. And again, that's the reason why you need repeat treatments of electrolysis. There's a final stage of growth known as the Telogen Stage. That is the resting phase of hair growth, and that's where the follicle is empty, the hair has shed, and you're waiting for the new hair to grow back. So hairs can remain in the telogen resting phase for a long time. So that sums up how electrolysis works and why repeat treatments are necessary, and also why intervals between treatments is very important to keep them as close together as you possibly can. Electrolysis does feel a little bit uncomfortable. If you're very sensitive, you can use a topical numbing cream. You can get them in the chemist. Emla is one numbing cream that you can get. That's usually on prescription. It's €5 for a tube of Emla. And then there's another over-the-counter numbing cream called Ametop, A-M-E-T-O-P, and that's only €3.50 for about a 1 gram tube. So it's a very small tube. You might need 2 tubes for an upper lip area. It's left on the skin for a full 30 to 40 minutes. You cover the numbing cream with cling film, and that will occlude the area and allow the numbing cream not to wear off or not to evaporate. You leave the numbing cream on until you come in here into the clinic. When we remove the numbing cream and clean it off your skin, that's when it begins to wear off. It wears off about an hour afterwards. So you can't just remove it, the numbing cream at home before you drive in here, because as soon as you remove the numbing cream, it begins to start wearing off. So you're better off leaving the numbing cream on. You can remove it in the car park, let's say, outside the door if you want, and then come in here if you prefer. But a lot of clients for upper lip hair will use numbing cream in advance of their electrolysis treatment to make it more comfortable. So I'll just show you an electrolysis treatment. Insulated protect needles, and they're more comfortable for the client. So we ask the client to usually remain quiet for the treatment because otherwise we won't get the needle in accurately. We insert a very fine probe into the hair follicle.
When the needle reaches the base of the hair follicle, we release an electrical current. This current cuts off the blood supply to the root of the hair and the hair becomes loose in the follicle. The hair will gently slide out of the follicle with the tweezers without being tugged or plucked. Accurate needle insertion is paramount in order to render the hair loose in the follicle. Otherwise, your therapist would end up plucking the hairs, and a good therapist will not pluck hairs.
Would you rate the discomfort out of 10, Deirdre? 10 is really painful and 1 is not painful. Where would you say?
Oh, I'd say 1.
1.
Yeah.
The length of treatment time that you will need for a treatment is dependent on the amount of hair that's present on the treatment site. So it's ideal that you clear the whole treatment site in a single sitting of the unwanted superfluous hair so that your subsequent visit will just be treating brand new regrowth, which is more likely to be in the active anagen stage and more likely to be killed off.
The one great advantage of electrolysis is when a client leaves the clinic, she is completely hair free. The hairs are removed from the root, so the skin feels nice and smooth. Also, in comparison to waxing, with waxing you must let the hairs grow. It must be at least 1/4 of an inch long in order to wax facial hairs. Waxing obviously is only temporary, it's not a permanent method. I don't believe waxing makes hairs any lighter or any more sparse. It doesn't make sense. If you pluck a hair from the root, like waxing is just a mass form of plucking. I don't see why waxing should render a hair lighter, finer or sparser. It doesn't make any sense. Whereas with electrolysis, it is a proven permanent hair removal method by the FDA. So from once you select an experienced, competent therapist with electrolysis, you will get good results, particularly if they're using a good quality machine. And a lot of clients that come in for electrolysis, with the naked eye, they often don't realise how many hairs are on the chin until we look through the magnifying lamp. So when I'm doing the treatment, I always look through a magnifying lamp in order to see the hairs. Often these hairs on the chin will be more obvious on a sunny day when the sun catches them under the light. Some areas are more tender than others, like the chin typically is not a tender area for electrolysis, but the upper lip typically is. So usually if some clients are having upper lip areas treated with electrolysis, they would tend to use topical numbing cream that is available in the pharmacy. So when an individual comes in for electrolysis for the first time, their hairs are going to be much more stronger to begin with. But as we go do a few treatments of electrolysis, gradually the hairs will weaken and we can use a lower intensity and it'll be more comfortable. So initially it can be a little uncomfortable. So electrolysis can be done even if you're pregnant because it's just a topical form of permanent hair removal. Now there are some forms of electrolysis that would use a current that would pass through the body, and those types of electrical current electrolysis cannot be used during pregnancy. So the blend type of electrolysis is not recommended during pregnancy. But most standard electrolysis machines can do standard electrolysis as well as blend. Some clients might need a half an hour treatment to remove the hairs. Others might only need a 10-minute session to remove the hairs. Ideally, when you come in for a sitting of electrolysis, it's best to remove all the superfluous, undesirable hair so that the next time you come in, we are just treating regrowth. So the regrowth, let's say if you come in today for a treatment, we remove every single one of the superfluous unwanted hairs. Then when you come back a week later for your next treatment, we are just treating brand new growth that is just emerging from the skin, which is more likely to be in the active anagen stage. So we'll get permanent reduction more readily on a vast majority of the hairs. Whereas if you have an abundance of hair growth and you actually require the 30-minute session, but you only take a 15-minute session, we'll only remove half the amount of unwanted hairs, and therefore when you come back a week later, we're still trying to tackle the growth. So we haven't gotten on top of the growth. It could take a couple of weeks to get on top of all the growth and then start treating the regrowth. So in essence, you get far better results if you initially take as long of a session as it takes to remove every single one of the superfluous unwanted hairs. Then it's
far easier to get faster results. And the reason for that is because you're straight into treating the anagen active hairs the following week. So I'm personally not a fan of facial waxing or facial threading for your chin or upper lip areas, because I personally feel because you're plucking the hairs from the roots, there's a chance you can stimulate the growth, the blood supply to the root, and therefore the hairs on your chin and your upper lip can become denser and you can get more of them. There's a small risk of a bruise with electrolysis, but it's not very common. Occasionally some clients might have an occasional bruise because we are using a needle, and if the needle punctures a vein on the way in, you will get a little bruise or a blood spot, but it's not very common. The aftercare for electrolysis literally is to, for 24 hours afterwards, to avoid heat treatments like sauna, steam room, swimming, because you've had a heat treatment and another heat treatment on top of that might leave you a little bit uncomfortable and might sensitize the skin, you know, your skin is irritated. And no makeup is allowed for 24 hours because, well, if you do have mineral makeup, that's fine, you can put that on. But certainly standard makeup can cause an acne spot because the pores are open from the heat of the electrolysis. So that's why standard makeup is not recommended. Mineral makeup has a large molecular structure, so it doesn't penetrate the pore, so it won't block the pore or cause any acne spots. So that's why pure mineral makeup can go on straight afterwards. But be careful that it's pure mineral, because there's lots of mineralized makeup that aren't 100% mineral. It's also advisable to keep your skin well hydrated between treatments, because well hydrated skin responds much better to the electrical current. We put on a Hydra balm afterwards and use galvanic current to penetrate the Hydra balm into the skin, as well as an antiseptic cream, and we penetrate that in with galvanic current, and this just cools the skin faster and it takes the redness down nicely, and in particular hydrates the skin for the subsequent treatment, because when the skin's really hydrated, as I said, you'll respond better to the electrical current the next day. I'm just putting on some Hydra balm on the skin, an antiseptic gel. Pop those 2 serums on. So I'm just going to do some galvanic roller on the skin now. Pop the pad on. The galvanic roller is not suitable if you're pregnant. So I'm using some galvanic current there to penetrate the hydrating gel and the antiseptic gel into the skin. This just takes 2 minutes, but it really soothes and cools the skin. The gels are penetrated in deeper into the skin by means of the galvanic current, and the client is less likely to get any acne breakouts or spots because the pores are open after the electrolysis. So this helps to close the pores and helps to soothe the skin. It'll take down the redness much quicker and takes any discomfort out of the skin.